Assalamu alaikum respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today the video number on our YouTube channel is 372. Mean 371 same videos are present of different subject. Now today our lecture is related to general surgery and today chapter is burn part 2. In part 1, we already studied the definition and types of burn, but in today part 2, we will study the classification of burn. Then in the third video, part 3, we will study the clinical feature of degrees of burn, then next pathophysiology, then assessment, then management. Now today is the part 2. Today topic outline include classification of burn. Now burn is classified on 3 bases. Before classification, first we understand the layers of skin. Now look at this diagram. On the right side, the layer of skin is mentioned. The first layer is epidermis, then dermis, and the dermis is divided into two upper papillary, lower reticular papillary contain capillaries, and lower contain collagen fiber. Then third layer is the subcutaneous fat. Now classification on the basis of thickness of skin involved. First classification on the basis of thickness of skin involved. On the basis of thickness of skin involved, there are 4 degrees of burn. Number 1 is the first degree burn. First degree burn, in first degree burn, injury localized to the epidermis, only localized to the epidermis. Now second is the second degree. In second degree burn are divided into 2. First is the superficial second degree, because second degree involve dermis, and dermis have 2 layer, upper papillary, lower reticular. If injury to epidermis and superficial papillary dermis, this is called superficial second degree. Now second is the deep second degree. Now deep second degree, in deep second degree, injury to the epidermis and superficial dermis plus the reticular dermis also involved. This is the second degree. Now come to the again look at this diagram. On the right side there is a layer of skin, epidermis, dermis, and subcutaneous tissue. On the left side there is only dermis is involved. This is first degree burn. If epidermis is involved, first degree burn. If dermis is involved, second degree burn. If subcutaneous tissue involved, third degree burn. Now come to the third degree burn. In third degree, simply we remember, if epidermis is involved, 1 layer involved, first degree. If 2 layer involved, epidermis and dermis, second degree. If epidermis, dermis plus subcutaneous tissue is involved, third degree. Mean full thickness injury through the epidermis and dermis into subcutaneous tissue. Again look at this diagram. Right side epidermis, left side degrees. Right side skin layer, epidermis involved, first degree, dermis second degree, subcutaneous tissue third degree. If epidermis, dermis, subcutaneous tissue plus bone or muscle is involved, this is known as the fourth degree burn. Now in fourth degree burn, in fourth degree injury through the skin and subcutaneous fat into underlying muscle or bone. This is the fourth degree burn. Now look at again this diagram. If only 1 layer, epidermis is involved, first degree. If epidermis plus dermis is involved, second degree. If epidermis, dermis, subcutaneous tissue is involved, third degree. If epidermis, dermis, subcutaneous tissue plus muscle or bone is involved, this is the fourth degree. Simple. If 1 layer, first degree, 2 layer, second degree, 3 layer, third degree, fourth layer, 4 layer, fourth degree. Simple. Second is the classification on the basis of skin thickness. first we classification of burn on the basis of skin thickness involved, but here skin not involved. Classification on the basis of skin thickness. Skin thickness may be partial thickness or full thickness. In partial thickness, first and second degree burn are included, and in full thickness, the third and fourth degree burn is included. Simple. If examiner says classify burn on the basis of skin thickness, we will be classify partial thickness and full thickness. If examiner asks first and second degree burn include in which thickness burn, partial or full, our answer will be partial thickness. Third and fourth degree will be included in full thickness. Now come to the third classification. Third classification is classification on the basis of percentage of burn or on the basis of severity of burn. Mean how much the burn is severe. On the basis of severity of burn or percentage of burn, we classify the burn into three. Number one, mild. Number two, moderate. Number three, major. First, mild. In mild, if partial thickness burn less than 15% in adult or less than 10% in children or full thickness less than 2%, this will be called mild. Now come to the moderate. In moderate, there will be second degree burn 15 to 25% burn in adult or 10 to 20% burn in children or third degree 2 to 10% burn. This is called moderate. Now come to the major. In major, second degree burn greater than 25% burn in adult or greater than 20% burn in children or third degree burn greater than 10%. This will be major. Or burn involving eyes, ears, feet, hand, perineum, which include perineum is present in pelvic region. All inhalational and electrical burns are come in major. Now part 2 is end. We classify the burn on three bases. Number one, classification on the basis of skin layer, thickness of skin layer involved. Second, classification on the basis of thickness of skin. Third, classification on the basis of severity of burn. Now part 2 is end. Now we have Telegram channel and WhatsApp group. Are you people? If you are MBBS student, we have channel on Telegram by name first to final year MBBS lecture. If you are BDS student, we have channel and Telegram by name first to final year BDS lecture. There we daily share notes, books, videos, past paper. We have also WhatsApp group for first year BDS boys and girls separately. There everyone can share notes, books, videos, and also request for any topic. For second year BDS, we have only group for boys, and also for third year BDS we have only group for boys. In future we will create for girls also. Now all these channel and WhatsApp group links are present in description of this video. You can directly join. Now after this video, in part 3 we will study the clinical feature of degrees of burn. What are the clinical feature of first degree, second degree, third degree, fourth degree? Now, if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.